We are responsible for all 5 of the domains, but just like there's a cooperative agreement between the State Health and Human Service Agency and ONC, there's a cooperative agreement between the state HHS and Carladenise. So we really are working in partnership around each of those domains. A good example is in the area related to privacy and security. They actually have a privacy and security advisory board at the state level. We're not duplicating that with Carladenise. We're working with them to ensure that we provide them whatever resources and tools that would be required to move or enable initiatives that come out of that advisory board's recommendations. And so we are responsible for ensuring that we enable exchange and we hit each one of those domains, but it really is a true partnership between our organization and the state. So right now, as the state governance entity, our primary responsibility is developing policies, enabling health information exchange between existing exchanges as well as disparate providers, and we're doing that through the development of a provider registry. But in addition to that, we're looking at ways in which we can provide resources in labs, e-prescribing, and then a huge area of focus for us, what we call a pillar, is consumer engagement and education. Ways in which we can increase the demand for health information exchange services in a way that improves accountability, transparency, and then efficiency in the system. And so to the extent we can find some activities that are supported either through revenue generation, grant funding, philanthropy, we'll start targeting some of those efforts really quickly. The major challenge will come from identifying a sustainability model and ensuring that we're not only able to sustain the entity in and of itself, which is responsible for the effort, but sustaining the effort as well. And so in essence, what we're doing is looking at a business plan and a strategy for sustaining the health information exchange initiatives that are spawned through this government effort. In addition to that, we're looking at ways in which we can come up with additional or secondary services that add value so that we can sustain the organization that's being held accountable for all of this work. So what we are doing is enabling the sharing of data between exchanges as well as healthcare systems, individual providers, our rural hospitals, networks, and the consumer. And so to the extent that we can use technological resources but also policy development to enable that exchange, that's our primary focus. California is a huge state with very diverse and complex health systems in and of themselves. And so the approach of having one exchange entity doesn't really fit for us. So to the extent that we can enable exchange between the healthcare systems, that's going to be a better use of our resources in terms of time, money, and effort. So we are working with the regional extension centers. There are 3 now in California, and so we meet regularly. We actually have here in California e-Health Coordinating Council that's run by Jonah Froelich, who's our state HIT coordinator. And so the HIE, the regional extension centers, the beacon communities, the telehealth network, etc. We all meet regularly and talk about ways in which we can support our respective efforts and also reduce the confusion or eliminate the confusion among the provider community about who to go to, when, for what. We want to make it, and Karen Hunt, our communications officer, uses this term, no wrong door, where regardless of whether or not they call Carladenise or call the High Tech LA, or call the California Telehealth Network, they get pointed in the right direction to get the service that they're looking for. So we have a engagement advisory work group which was established by our board of directors, and so through that work group we're actually in the process of exploring what would be the most viable options for engaging consumers in the enabling of health information exchange. So we've talked about education and outreach, public service announcements, as well as creating a patient portal or personal health record, some type of enabling technology that then also attracts them, mobilizes them, and helps them participate at the consumer level. This work that we're doing is so incredibly important. I think we underestimate the complexities of it at times, and I think we overestimate the consumer or the patient's understanding of what we're doing and why. And without being able to speak to them in a way that enables exchange through the demand of that service, I think the effort is going to fail. And so eConnect has made a commitment to not just enabling technology, but also enabling a broader and greater understanding of how technology can improve our healthcare delivery system. And I think that's just as important as plugging the computers in and teaching people how to use them. And so for us, the consumer piece is just as important as the technology piece, as well as the policies that are required to ensure the appropriate governance and protection of the information that's being shared.